Well, it's a pleasure to be here. I am honored that you invited me. I must say that I started my career in a very similar place to where many of you are now. I went to the State University at Albany in New York for my graduate degree, and I became an intern, and a green intern in the governor's office in Albany. And so I'll tell you a little bit about that background. And today, I am the CEO of CareFirst, and just a few additional descriptions of CareFirst. First, it is a nonprofit. And so there's a very interesting difference between a nonprofit and a for-profit company. More than meets the eye. There is a difference between a mission-driven organization and a bottom-line-driven organization. And part of thinking through what you might be interested in is whether or not you choose one over the other, or actually it chooses you. And I'll speak a little bit more about that. But here is CareFirst. CareFirst does serve just under 3.4 million people that represent about 43% of the total population in Maryland, the District of Columbia, and Northern Virginia, people that are not covered by government programs. By that I mean Medicare, Medicaid, Children's Insurance Program, government programs. We have 43% of everybody else. So it represents the greater swath of the whole community. We handle about $33 billion a year in claims. We handle 1 billion transactions. We do 37 million claims a year to cover people for the services that they need. We give about 55 million a year to the community, just give to the community beyond the other services that we render. And we are a mission-driven company. That mission was given by a combination of the U.S. Congress. We're the only Blue Cross Blue Shield plan in the country that was chartered by the U.S. Congress, and by the state of Maryland, the legislature. There is a diorama outside of our boardroom that I use as a metaphor for what we do. And it is a picture, it's a diorama of a person looking in the window of a doctor's office at a patient being treated by a doctor. And on the outside of that building, there's a little sign, cash required. And the meaning of that diorama essentially is that healthcare is for those who can afford it. And increasingly, the American public cannot afford it. And so we sit, if you will, we occupy a space that is in the middle between the people who need the coverage and who buy it, particularly the employers who buy it, and then there are the individuals who buy it. Between what they're saying is, it is so expensive we cannot afford it, and the providers who provide the service who say, you don't pay us anywhere near enough, and we cannot make do with the reimbursements we get. And so there is an incredible tension. And bear in mind that in this country, we do so much through the private sector. We are private sector. We are nonprofit, but we are not government. We are very closely entwined with government. But we recently were visited upon by the French health minister and a whole delegation who came in and said, why do you Americans do it the way you do? Why don't you have a system for all? That is a very good question. Maybe we'll come back to that question. But our mission is to serve those who need access to healthcare services in the most cost-effective way possible. Maximize access to one of the most basic human needs. And so as missions go, I would say to you, it's a meaningful mission. It matters what we do in the sense that if we do it well, it really matters, and if we do it poorly, it really matters. And so when you're put in that position with the tensions that exist, you feel it. So let me come back to that story. I started my career, and I think this would be true. I don't know what other CEOs would say, but this is what I would say. To be a CEO, it's a combination of things very much associated, yes, with hard work, with certain skill sets, and with substantial good fortune. And no CEO could say that they are where they are by virtue of their own merits alone, however meritorious they may be. So let me describe that to you in terms of my own experience, if that is in any way instructive, and to look back at my experience and say, are there lessons in it that I would draw, having lived through what I lived through? I came from a family where my grandmother, who was very influential in my house, I was a triplet. My mother had triplets, and in the days before ultrasound didn't realize she was going to have triplets. A bit overwhelmed, my grandmother came in to be with us. My grandmother never got out of high school, never got out of grammar school, to be specific. My mother and father graduated from high school, nothing more. I came from a family conscious of limited means. I learned early on the value of hard work and of what it meant to try to be independent and not dependent in life. I went to a small liberal arts college, independent liberal arts college, and there began to, if you will, as you must, take your own measure, find out the things that you're interested in. I didn't know what to do. I was heavily influenced, maybe my whole generation was, by what went on with Jack Kennedy when he was president, visions of Camelot, influenced by the March on Washington, Martin Luther King, the Civil Rights Movement, searing images, and the Vietnam War, the disbelief and trust in government on the one side and believing that government on the other could be an incredibly important and proactive agent of change. And I vacillated back and forth, didn't know what I wanted to do, but sort of found myself drawn in general to public policy and to one thought. I wanted to do something that mattered. And I think, I'll tell you a story. I don't often tell this story. But to tell you the mindset that I came out of. I was learning to play the guitar. And I needed a pick. I went into a guitar store. And I came out with one pick. It cost 25 cents. And the guy that was with me said, "Why did you buy just one?" And I said, because it never occurred to me to buy more than I needed, even though it cost 25 cents. If that tells you something about the mindset. So when I went to college, it greatly mattered to me and my parents, and it was a step they never took. And then I went to graduate school, to a school like this. Maybe not as good as this. Didn't know what I wanted to do. It was true, I majored in sociology, But it was also true that I was so equivocal about what I wanted to study that I was afraid I wasn't going to have enough credits in any one major, and I just made it through on sociology. Went to graduate school and took public affairs, public policy, again driven by a general sense of interest, but nothing more. And on a fluke, saw on the bulletin board one day that there was a program for interns that Nelson Rockefeller, when he was governor of New York, had started, which was to attract master's-prepared people into state service as interns on the hope that what they would do would be to enliven and professionalize the service, state service. This was sort of the heyday in New York. On a fluke, I took the exam. It had to be an exam. I scored well enough out of 2,500 applicants to get one of 25 slots. I didn't know what I wanted to do, so I thought I would pick the one that was closest to the source of power, and that was in the governor's office, and more particularly in the budget division of the governor's office, because I thought that's where the money and the power was, and I don't know what I want to do, but I'll do that and see what happens. And I was able to do, as a consequence of that, studies of labor policy, economic policy, tax policy, and eventually came to health policy. Never had the slightest interest in health policy until I started to get into it. And wound up very, very interested in that field. Got into a whole array of things, setting up a new regulatory agency, and then was asked to run the agency, thing I never planned on. And I was 28. And you could say, and would be completely correct, they were out of their mind to do that. Got a call from the governor's office one day and said, we need somebody to run the state's largest agency. At that time, it was the Office of Mental Health, Behavioral Health. It ran 38 psychiatric centers, had 37,000 employees, and billions in local funding for local programs. I wasn't particularly attracted to the subject matter, but I agreed to do it. And then got totally into the subject matter, beyond anything that I would have ever expected. And there were all kinds of issues in serving that most vulnerable population. If you want to think of vulnerability, think that you are poor, that you are disadvantaged, and that you don't necessarily possess all your faculties. And so many fell on the state. And I learned the importance of service. And there is much about leadership that can be captured in the word service. In fact, I would tell you that the higher you go, the more you serve. If you ask me what I do, I serve. I lead, but I serve. And that maybe sounds hokey. But I didn't plan these moves. These moves came. One day I got a call from the president of the Blue Cross plan in Albany, New York, which is where the capital was, which is where I was working, who said, would I come to lunch? Didn't know what he wanted to talk about. And he said that he had been diagnosed with terminal lung cancer. Would I consider being an executive vice president? Didn't know how much longer he had. Work with him. Perhaps, as things would work out, I would be his successor. They did a search, a lot of competition. I got the job. Never planned it, never saw it coming. And he died 3 weeks later. Turned out, didn't know it, we're bankrupt. Couldn't make my first payroll. Had to call the state controller, who I knew, to advance funds to make the first payroll. And we went on to basically overhaul that organization. many good people in it, but had run itself on the ground. From there, went into the private sector. Never planned that. Started a company from an idea. Walked out of the presidency of Blue Cross alone with an idea. I was 40 years old by that time. I had taken the presidency of the Blue Cross plan at 34. The idea was if you could organize networks of providers and you could incent them to provide more cost-effective quality care, what would you do? How would you do it? And what technology would you use? And I was able to get funding for it, enough to get through the first year, and then got other funding, and it was private equity. And we built the company from an idea to 800 people, with 800,000 people served by the company in many different markets in the United States. I can't say that I planned to do that originally, and then went from there to a call that I got one day driving on the New York Thruway. Would I come to talk investors about the company that you mentioned? Basically to dress it up and sell it. And I found out that that company, RealMed, actually had some really interesting ideas, and we built it up. Today it is one of the largest electronic clearinghouses in the United States for healthcare transactions. And then one day got a call that this company that I now head was looking for a CEO. Never planned it, never saw it coming, wasn't even thinking about going back into the nonprofit world. I'm about to hit 6 years as CEO. So there's one lesson I would draw from this. And that is, whatever you think your plans are, they probably won't come out that way. And whatever opportunities you think you can engineer probably aren't the ones you're going to get and the ones you're going to take. And therefore, there's a certain amount of broken field running that is necessary, a certain agility. And there's a certain degree, and this is what I said at the outset, luck, good fortune. It doesn't have to be happy. It doesn't always work out. But in looking back, what mattered? What was it that mattered the most? And this is what I would tell you, and in a sense, it's sort of deeply old-fashioned. It is what my grandmother used to tell me. It has to do with attributes of character. So, are you honest? Faithfully honest. Are you diligent? Do you persevere? Are you balanced? Strive. Do you aspire? Aspiration. Absolutely essential. And then what is it that you aspire to? And what I can tell you in retrospect, and this is me, this is not necessarily, all I can tell you is my story. Aspiring for something bigger than yourself. In some ways bigger than money. Do you aspire to get paid more? Perhaps everybody does. Do you aspire to higher title? Perhaps everybody does. I can say I did, but I aspired also, it was going back to what I said when I was in graduate school. I aspired and I thought perhaps I could make a difference somehow. Not for myself, but for others, and perhaps those that were the most vulnerable. Let me tell you a story. When I was running the Office of Behavioral Health in New York, with many, many thousands of employees, this touched me. I was brought around in my first week to the various psychiatric centers. And then when I went to one in the Mid-Hudson area in New York, I said, leave me alone for a minute. I always had this group with me. and I looked through the doors of a ward. Nobody knew I was looking that was on the other side of those double doors. And there was a woman in there, lovingly taking care of what you would say were the most vulnerable people on earth. Nobody was watching, and she was not aware that anyone at all looked at her, let alone me. And she did what she did because she was motivated to help them. I never forgot that. I tell you that today, that was 35 years ago. There are people like that everywhere. And so the question is, what is it that motivates you? We all aspire to matter. I would say to you, there is great reward in getting lost, losing yourself in a mission, in a purpose. If you think you're in a job and you're aware that it's a job, you may be in the wrong place. If somebody said to me, Chet, do you have a job? I would say no. I don't have a job. I have a cause. I have a purpose. And I want to see to it that it's accomplished. And you get there by degrees. You get there in part by will, by resourcefulness, by intelligence, and by the old-fashioned attributes of character. One of the most pleasing things when you're in a position like mine is this row right here that joined us as young people from this school. And just like I had a chance to rise up, they will have a chance. I often think when you go into parts of our company, particularly like the systems and technology areas, what you will see is something that looks like this room. Every nationality, color, ethnicity, belief, all working together, lost in what they're doing, whatever it is they are building. When that happens, you're no longer thinking, I have a job, but I have a cause, a purpose. So my advice in looking back on things is to say, if that is not what you find yourself in as a set of circumstances, seek to relocate. I would tell you this as well, that whatever it is you have in you as a set of innate capabilities, that if you are in the right circumstance, the thing that most enlivens you improves you and makes you more valuable to the organization that you become part of. In my own case, one of the things for me personally was a reticence, a shyness, a lack of confidence, in part because of where I came from. Learned in my own family, not that they wanted me to learn that, but a caution because of what I saw, how hard my parents worked and how they sacrificed for me. And it made me think, what is my potential? And I was cautious. Looking back now, the opportunities that I was given came to me in an unplanned way, partly by preparation, partly by diligence, partly by luck. Take advantage. I said this to our interns. You have gone to a good school, and now the light has shined on you. Don't underestimate how important that is. Make something of it. Make a difference. Matter in what you do. If you are nothing more than the aid that I look through that door, make a difference, not because you are somehow compelled to do it, but because you are drawn to do it, because it is what you believe in. And those are very old-fashioned things. And so in our company, we are a highly complex company. We are highly regulated. We are in a highly competitive market. You cannot have more business challenges than we face. And we are in a field that is undergoing immense transformation. The central challenge is, can healthcare be made more affordable to the population in this region? And if so, how? Let me put that in perspective. Healthcare costs in this region for the last several decades have risen at about 10% a year, almost 10% a year. And the old rule is, costs that go up 10% a year double in 7 years. And so what we've seen is a doubling, a doubling, a doubling. Spend more on healthcare in the United States than any other country on earth as a percentage of GDP. This region is no exception. So if somebody said to us, you exist in the middle of it all, you process all the transactions, do you have any insight? Is there anything you would do? Is there anything you would recommend? What would that be? And our answer can't be, don't have a clue. And so we develop programs that are now broadly applicable in this region. And the people of the company developed them and implemented them and are proud of them. Why? Because they think that it mattered that they did it. And it unlocks human potential and unlocks human energy. The healthcare field will undergo and is undergoing some of the most profound changes ever, probably since the introduction of Medicare and Medicaid. And that was in 1965. Our role, as I said, sits between the people who pay the bill and the people who provide the services to support the needs of the population. We are a huge user of informatics. We are organizing networks of providers and sharing information with them over the web 24/7. We have online the equivalent of 300 libraries of Congress. And if you were to make a query, it would be available in about 2 seconds on a specific member picked out of the millions. That technology is only available today, and for many years was not available, now is. The people who develop the system are the people of the company. The people who sell it are a whole set of different people in the company and explain it. But it is the idea that it makes a difference that is the most motivational to them. And so the lessons I would draw are all around that. I am fortunate to have the kind of people in the company that we have. But I would tell you that in every company I've ever been in, including the one I started from scratch, it was about the people's unlocking the human potential in the people involved. Do you know what you want to do? Maybe you think you do. It is almost certain that you won't be doing it. But do you know what is important to keep your eye on? It would be, in my mind, the things that I have just described to you. Do you aspire to be a CEO? Do you aspire to be something else? I can't say that I directly aspired, in my case, to be a CEO. I wanted to make a difference. It turned out I was a CEO. There are many ways to make a difference. So what do you want? Ralph Waldo Emerson, in July of 1838, was asked to speak to the graduating class of Harvard Divinity School. And what he said there was so controversial in its day, they didn't invite him back for another 25 years. But this is, in essence, what he said. You who are called, in this case, to divinity school, to be preachers and ministers and so on, if that's your calling, then feel it deeply. Pull on the whole mantle of commitment. Do it with your whole heart and convey it to others, and you will succeed if that is your calling. And don't be bound by the dogma and the teachings and the rigidities of the established church. And that's what was so controversial. I go back and I reread that. It's at times overwhelming if you sit in the seat I sit in. People, I was asked to describe what it's like, what's a day in the life of a CEO? Do I play golf on Wednesdays and Thursdays? Do I belong to rich country clubs? Do I go to fancy places to eat? Am I privileged in every way? Am I an evil, manipulative insurance company CEO? Think of the stereotypes. A day in the life of a CEO, as I experience it, is very typical like today. My day started today at 3:45 in the morning. Every day starts at 4 o'clock, no later than 4 o'clock. Now this is my way. And from 4 to 6 in the morning, I review an endless stream of things coming into me, of all different stripes and flavors, from all over the company. Now, if I don't do it, things stagnate. Decisions aren't made. And if that happens, people realize that and bypass the whole process, because things can't stagnate. Almost everything I deal with is a shade of gray. It's not a black and white, easy decision. There's always trade-offs. So from 4 to 6 in the morning, total in the blackness of my library, with one light on, no distractions. I am focused on that. Run around like a nut for a half hour to take a shower, get out of the house, and drive up to my office. And from about 7:15 and 7:30 in the morning till typically about 6:30 at night, I feel in some ways like a doctor rotating among exam rooms. I go from one conference room to another, and there are different groups in those conference rooms. They all have their issues, they all have their concerns, and they all want decisions, and you rotate around. You give out assignments, you better remember what you gave out. You create expectations. You create subtle but powerful standards. And you create culture. And I would tell you that it is the combination of purpose and culture that is the most powerful source of change in any organization. If the culture is one of intimidation and threat and gotcha, it will cause behaviors within the company that become profoundly dysfunctional. If it is more open, more fluid, it more opens up human potential. Everybody makes a contribution. Everybody understands the purpose. And the purpose is bigger than me and bigger than them. And the purpose matters. And so I say to people, do a good job, as I said to you, it matters. And do a bad job, it matters. Give it your best. In between this are speaking engagements of all stripes and flavors. I was the keynote speaker yesterday at a national conference in D.C. on a technical subject in healthcare. Sprinkled about is a public presence. I typically get home at 8 o'clock at night. if I don't have something like I have tonight, which happens 2 or 3 times a week. I rarely go to a restaurant. I have my lunch, my breakfast is a protein bar in the car in the morning while I drive in, while I am on the phone with somebody else I'm not even aware how I got to the office and whether I had the bar. Lunch is a lean cuisine in the middle of a meeting. I'm not even aware I'm eating it. And by the time I get home at night at 8 o'clock and my wife wants to talk about something, I'm saying she accuses me coming home like a stroke victim. I'm done. That's the way I've experienced the last 6 years. Would you say that is a job you aspire to? Why would anybody do that? Well, you wouldn't if you thought you had a job. And if you thought it was work. And for me, it is not. Why does the painter paint? And why does the musician write or play? You need to find for yourselves that which opens your own potential. That's easy for me to say. It is incredibly hard to do. And I've had the good fortune of having good fortune mingled with the attributes of character that I described. Our field is incredibly ripe with opportunity. It is also incredibly ripe with danger. When I said to you that the French minister came and said, "What in the world do you Americans do? Why do you do it the way you do? Why isn't health care provided as a right of citizenship?" You know what my answer to that was? It ought to be. And it's not. And in our region alone, 1.1 million people are uninsured. We support safety net clinics throughout the region. I met with them the other day. And most of what they serve, the people they serve, are undocumented. And were it not for those safety net clinics, those people would get no service. For their children, for their family, it is not theirs to have. And for even citizens of the United States, many, 50 million Americans, you don't have access. So what the Affordable Care Act offered and offers as a hope is that they will get access. And what we're expecting, we are less than 2 weeks away from the advent of the exchanges. And I'm sure we will have a carpet bombing campaign of advertisement to make everybody aware. It's already beginning. Exchanges exist. In Maryland, Maryland is considered one of the leaders in developing exchanges. And what is the idea? The idea is that somebody could go onto the web and, like you would buy a car or you would buy any other commodity, you could pick a health plan and say, that's the one I want. And if you had low income, you could get the government to subsidize it as much as 80%. And so over the next decade, if ACA were to play out the way it was intended, which it will not, the government would spend close to $1 trillion on the subsidies, those that are of low income. And with low income often comes deferred health care needs, real need for health care services. So it's going to start on 10/1. We happen to be the lowest price carrier in terms of the premiums that we will charge of anyone on the exchange. So we're expecting that much of this investment will come to us. And with it will come enormous risk and potential huge operating losses, financial losses, and major new service burdens. Should we or could we say no? We can't, and we won't, even if we could. I was invited out of the blue to the White House not so long ago, a few months ago. Not your everyday invitation. Came to me like this: the president would like to see you. What do you say? Too busy? I don't know if any of you have been in the White House, but first of all, you get security clearance before you go that's pretty extensive. And then you go. You walk up to the front gate, and there's a guardhouse there, and they already know you, and they clear you through as if you were going through an airport screener. And I can tell you, I've done this a number of times. It doesn't get old. You walk up the driveway to the West Wing. And so I walked up the driveway to the West Wing. And you know, when the leaders of Congress come out after a meeting with the president and Boehner's complaining about this and that and whatever, they're doing it in the portico of the West Wing. So I walked up the portico of the West Wing, and there's a Marine there at the door, like a statue. Opens the door for you, the Marine on the inside, and you go into this interior waiting room. And I found out that there were 6 other CEOs invited that day. And you go through the waiting room, and we were escorted into the Roosevelt Room in the West Wing, which is right across the hall from the Oval Office. And each of us had name tags. It was already organized. And then walks Kathleen Sebelius, and then in walks the Chief of Staff and a variety of other deputy staff people, and the whole room filled up. Everybody's waiting. What's going to happen? We were told nothing. And then the president walks across the room from the Oval Office and walks in, shakes everybody's hand. And there was an empty seat across from me on the table. That was his chair. It was not at the head of the table. And he said, please, everybody sit down. And he launches into, I would say, 15 minutes of his analysis of the situation. And this is essentially what he said: that any huge change like ACA has its bumps. Surely there will be a rocky start. This has happened before. That he considered the public option, in other words, covering everybody under one government program, and he rejected it for 2 reasons, one practical and one philosophical. The practical one was he didn't have the votes in Congress to get it passed. Why push for something you cannot get? The second one was philosophical, he said, which was, I'd like to use the private sector, you, to get this done, because you're going to be more creative, you're going to be more inventive, you're going to be more driven, and I think I can, on behalf of the country, get a better result if you do it. And we're all sitting there thinking, well, what is he going to say next? What is he going to berate us? Is he going to demand? What is he going to do? And then I was slightly diagonal. The guy sitting right across from him was the head of WellPoint, the biggest in the country. And he says, Joe, what do you think? And Joe's like, ooh. Out of the blue. I can't remember what Joe said. And I was sitting next to him. The president never took his eyes off him. And then he said to me, Chet, what do you think? I actually told him what I thought. And I told him I did think there was going to be a rocky start. And I did think that the lower income, sicker people would get coverage, but that might cause a spiral in the premiums and price it out. In other words, if you're only insuring burning houses, you don't last very long. I can tell you this, and this was my distinct impression. He never took his eyes off me or anyone else, and he went around the room and asked every single person. And you had the feeling that he truly heard you and understood what you said and nodded always in the affirmative, like, I hear you. But I would tell you this, there's a big difference between I hear you and I agree with you, or I will act on what you say. And so there was a determination in that room that he led that basically felt like a campaign. We will get this done. And I am asking for your help, is what he said. No one on his team said a word. And then at the end, he went around the room and he summed it up at the end in about 10 minutes. And he basically got it right. And then he went around and he shook everybody's hand and he said something to everyone, including me, that indicated that he had actually heard what you said. It was kind of impressive. It was humble and powerful at the same time. It was understanding and determined at the same time. It was able to grasp some of the technical aspects of it, but not forget the political. It was impressive, is all I can say. And he said something else. He said, there's a lot in it that I know needs fixing, and I would normally want to do that and go to the Congress, but half the Congress is so hostile that I cannot get that to happen. So let us work together to try to overcome it. What do you say except, yes, Mr. President? My take, we will go through a very rough period. It will transition to a state of being that nobody, me included, can quite foresee. It will have many unintended effects. Whether we arrive at a better place, I don't know. I do think many who are not insured today will get coverage. Whether it's sustainable is uncertain. And I wish I didn't have to say that. The most underlying societal challenge we face is why does healthcare cost what it costs and how to stop the spiral up. Let me put it this way. If we were to double in cost again, nobody except the wealthy, not the government, not the employers, and not individuals, could afford it in 10 years. And in the life of the company and in the life of the country, that's a nanosecond. Health cost is to healthcare what carbon dioxide is to global warming. It's the ingredient that when you get too much of it, cooks you. And so much of the energies of our company are oriented around that. What would you do? And can you encourage Americans to live healthier lifestyles? Epidemic of obesity, of diabetes, of coronary artery disease, it all clusters together. The rise of chronic disease in the population at younger ages is a huge challenge. What would you do? How would you encourage people to live healthier lifestyles? It is into that and working with providers to incent them that so much of the energies of the company and the data that the company has, it is into that effort, into that purpose, that we're asking the people of the company to unlock their potential and contribute to a solution. And in that, there is meaning. And if you get well paid at the same time, great. But it's the purpose that most enlivens people. And it's why they huddle at 8 o'clock at night around problems that they're jointly solving together. And they look like you. And they are you. And it's my great privilege to lead them. What does a leader do? but to establish the purpose, to help people see the higher purpose, to do them the respect of considering their judgments, of letting them be heard, and of telling them the whole picture, not simply the part of the picture that they work on. And to foster a culture that rewards initiative. That's what a leader does. And that, to me, is what you call service. It is to serve. And if I look back at my time, the thing that I have enjoyed the most in my career is fostering that kind of culture, allowing young people in as I would have wanted to have been when I was an intern. An experience I have never forgotten. I would have wanted to have been considered valuable. I would have valued if somebody had listened to me and considered my judgment to be important to listen to, and would have considered that I was worthy of being told not only the goal, but the whole picture, and even though I was only working on a part, that you gave me the respect of telling me the whole. The idea to build, to create, to implement, to have an impact. If anything I have said in any way resonates in you, live it, as Ralph Waldo Emerson said. Pull it on, all of it. And if you find yourself in a job, find something else, as hard as that may be. It is not about the money, although money is important. It is about the purpose, and the money follows. And when you get it reversed, you suboptimize both. So I don't want to go on. I was asked to come to talk about how it was that I got to be a CEO. I don't know. I know only what I've told you. And what it's like to be one is to serve. The ones I admire the most in public life, in private life, indeed in this very university, Bob Smith, believed much the same thing. It seems to me that it was yesterday that I was that intern. I was you, not knowing what I wanted to do. I can tell you, it goes fast. So what you seek, go to the source, go to what matters to you the most, and go to something bigger than yourself. It is not about you. Forget yourself, lose yourself in the purpose, and make the purpose worthy. It's more of a prescription, I think, for fulfillment, at least for myself, than chasing money and then the purpose, which never quite got me there. So thank you for listening. Thank you for letting me share it. I wasn't sure I said this to Bev and to Michelle, who came with me. I wasn't sure what I was going to say. But if this in any way sheds any light on what it's like to be a CEO and how one becomes one, then I'm glad. And if it didn't, I'm sorry. Thank you.
Thank you again.
Pleasure.
open the floor up. We have about 10 minutes for questions. Could I have my 2 assistants please come down? I'm in an interesting way, so people have to run up the aisles for me this time. Thank you. So a few questions were emailed to us in advance, and I wanted to start with one of those before Abby and Lily take other people's questions, and that would be actually one of our EMBA alumni, Brian Taylor. So Brian, if you wouldn't mind sharing your question, one of these ladies will actually, I think Lily, yeah, one of them will run a mic up to you. Okay.
Thank you very much for taking my question. I work in molecular diagnostics, and there are a lot of tests that are being developed that are expensive, but they're very informative. And I'm wondering if you can talk about how it appears from your side of the ledger. We can do things to help science move forward, but the costs can be quite high. And I'm wondering if you can talk about how the trade-offs look from your side.
Yeah, that's maybe a central question. I don't know what it costs to get the service or the test that you would create, but there are, for example, to draw a comparison, drugs that are available that cost $120,000 a month. Just to say how expensive can be. You can't analyze it by saying the individual ingredients are so expensive we cannot do it. I don't think we as a society can get there. It would stifle all innovation. So the way we look at it is this. It's called total population health. So just think of this. We organize, just as an illustration, small teams of primary care doctors. The average team is about 10 doctors. They're supposed to work as a team. They're supposed to know each other. They're supposed to share data. The average panel of 10 as a team treats about 3,000 of our members. 3,000 of our members could be expected to run up $12 million a year in healthcare costs and have something in the order of 60,000 encounters with the health system. Into that context, writ large, your creation finds itself. Our attitude on this is your job as a panel, as a team, is to get the best health you can for your patients in the aggregate. If it is worth it to have that kind of test to avoid future breakdowns or more certain diagnosis and better treatment, better result, do it. Now, if it's so experimental and its efficacy is so questioned, that's a different matter. It's not just our interest in this. Employers will say, I don't want to pay for that because I don't have any conclusive evidence that it actually works. But our approach is to say total result for a population of people is what matters. So let me put that in perspective. Think of a pyramid. And at the top of the pyramid, think that 3% of the people are at the top of the pyramid. This is true anywhere in the United States. It's certainly true here. Those 3% are critically ill. These are major trauma, neonates, cancer, major heart disease, and so on. That 3% consumes nearly a third of all the dollars we spend, and we spend $10 billion a year in 3% of the people. The next 7% of the people are multi-chronic. Obesity mixed with diabetes and heart disease, and you're on 15 medications, and every once in a while it flares up and you're in the hospital and then you're back out. They're another third. So in the top 10%, you have 2/3 of all spending. It is not the unit cost alone that matters. It's what the result is that you get for a whole population of people. If what you create, endless stream, one of the great things about America is the endless stream of creation. of new tests, of new treatments, of new interventions that actually have the hope of better health, better quality, and lower overall cost. Where the real cost is in the fragmentary nature of the healthcare system in this country and the falling between the cracks that people experience. So you're discharged from the hospital. You might as well be, in many cases, discharged into the vapor. Nobody tracks you. Nobody follows you. It's daunting to access a field of specialists. You don't know what to do. And oftentimes with disease, depression is mixed in and other psychoses, and it further clouds your judgment. And a lot of these people, this is unbelievable to say, are 15 to 20 prescriptions at a time. And they go into the hospital and get 9 more. And it's scattered all over the kitchen sink and in the bedroom, and they're all confused, and they break down. Your particular thing, the way we would look at that, is to say, can that be a tool to a better outcome for some? And is that outcome going to translate into better results over time? It matters over time. And so what we do with these teams is establish targets for the whole. And we say, any way you can get there, get there. But any system designed by man can be beaten by man. Assume that. What we've tried to do is to design a system of incentives and accountability that say, there's only 2 ways to beat it. Lower the cost and improve the quality, and you cannot lower the cost without improving the quality. And so if the inherent characteristic of what you describe is to improve quality because it makes diagnosis more sure and treatment more sure, and that has its effect in the long term, all for it.
One thing that will make a big difference is if your informatics system can turn N of 1 experiments into N of many.
We do that as a routine matter. And we look at the patterns, and it's counterintuitive. Everything you think might happen doesn't happen that way. But that is the essence of what the informatics area does. It's to see those patterns. Yes. Oh, I'm sorry.
Hi, everyone. I'm Stephanie Graff. I'm an undergraduate here in the Smith School. Thank you so much for coming to talk to us.
My pleasure.
That's a great opportunity. So my question is, one of the hardest parts of being a CEO is delivering bad news. And although you did it very eloquently, you talked a little bit about the dark future ahead for rising healthcare costs. So how do you plan to engage your stakeholders, ranging from employees to employers who are purchasing your plans, and keep them looking at the future, focused on the positives, and the broader goal which you talked about, which is really the bigger picture and providing healthcare to all Americans?
Well, let's start by saying that we want to tell the truth. Mass delusion is not the answer. Happy talk without happy basis, not the answer. What is the reality? We tend to favor 2 things, and that's with every one of the constituents we deal with. The first is transparency and information. It gets to the informatics point. Do you know the patterns? Do you know what can you see? What can you understand? And the second is incentives. There's very little that we are doing that puts penalties on people. What we're trying to find are ways to incent healthier lifestyles, to incent access in a more cost-effective way to healthcare services. Not an easy thing to do. And we can't be the only party at interest. If the provider has no incentive, we will not get anywhere. If the member that we serve has no interest and incentive, we cannot get there. So what we've tended to put the emphasis on is transparency and incentives on all of the players. There is no penalty in what we do. Some think that that's the way to go. Others think shift risk to the provider. Put a lot of risk on them, and they will pay attention more. And we would say, nonsense. Most of them are not in a position to take risk. Or they would say, and you hear this a lot, consumer-directed healthcare. Have you heard that? Consumer-directed healthcare. My son had headaches that started when he was in college. Did he need an aspirin? A neurologist? An allergist? An immunologist? If so, which one? I had no idea. And he went through all of them. 10 years later, we found he had gotten in school a fungal infection in his sinuses that was not so easily knocked out by antibiotics or anything else, and was misdiagnosed many times along the way. Could he have, as a consumer, dealt with his issue? The way you would deal with a toaster? No. And so we believe that you have to have, within any sphere, certainly it's true in the healthcare field, there are better providers than others. Who are they? That's determined by the data and the outcomes they achieve. What we want to do is highlight that and incent going to them and create, in effect, a marketplace, but not shift too much cost to the provider. Certainly don't put a penalty on, and don't put the penalty on the member. One of the things that's worrisome now is we see the rise of high deductible health plans. Let me describe, I don't want to go on and on here, but let me describe what a bronze plan looks on the exchange like. You know, you heard platinum, gold, silver, bronze. Those are the choices you have on the exchange. Let me describe a bronze plan to you. This is by federal law, ACA. It has a $4,000 to $6,000 deductible. Let me stop right there. It integrates drug and medical into that deductible, meaning if you go to the doctor, that's part of the deductible. The doctor runs a test, that's part of the deductible. And the doctor gives you a prescription that you go across the street to the pharmacy, and that's part of the deductible. So it's not a $20 copayment or a $10 copayment for the prescription. It's you need to pay $187 for the drug. The out-of-pocket maximum, the amount that you could pay in the aggregate in a given year, is $6,350 by law. That's a bronze plan. Now think about that. And if you have chronic disease, and so this deductible resets every year, your disease doesn't go away. People are saying, my God, that's just too much. I cannot afford that. We see people turn away needed services because they can't afford a $20 copayment. God knows what this will do. Now, the subsidies are there to help. But our whole approach, the thing I deeply believe in the stakeholders, one stakeholder is the person, the covered person. And where that starts is awareness of their own health risk. And that comes, we think, through a health appraisal with blood work that says, this is what you look like. Look at you. You should have died 3 weeks ago. No. You are high risk. And we find that people change, not all the people, but if there's a hope of change, it starts with awareness that typically isn't there. That's information. On the provider side, we give incentives to properly diagnose, to get a better outcome for the patient, to pay disproportionate attention to the people who need the doctor the most. The average encounter with a primary care doctor in the US is 7 to 10 minutes. It's a flyby. And what happened to you downstream from them? They didn't have any economic interest in or otherwise an interest in, except as part of their medical practice. We've created a change in that, where they have a direct interest in that, financial interest in that. And guess what they're doing? They're paying attention. So the member has an incentive, and the provider has an incentive, no penalty. And then the employer, going to sit there passive, do nothing, have nothing you're prepared to do as an employer? We have an employer we're talking to right now. They cover 98% of every bill that comes in. They're a sieve. And they complain that their healthcare costs are rising, but no idea about how to, what their role ought to be. And so what we advise employers is, well, here's what you can do, and be more proactive. And in our company, a basic, simple thing, I'll just use it to illustrate, is groups of people that get together for fitness purposes, for weight loss purposes, for smoking cessation purposes, and in the work site with your peers, there is a cultural support to behavioral change. So to get the stakeholders involved, whether it's the employer, the member, or the provider is absolutely critical, and then show the information and provide real reward to change. And I will tell you, even doing that, you will reach only a certain portion of the population. You can't reach everybody, and you can't solve every problem. But you can marginally improve the overall outcome, and that margin may be the critical difference of whether the healthcare system is sustainable or not. It's a daunting thing. Let me give you one other story that puts it in perspective. I've told the story before. I was driving down Wisconsin Avenue in DC with my nephew, 10 years old. And he said, "Can we stop at the McDonald's?" Now, against my better judgment, I relented. We stopped at the McDonald's. This kid walked out with 2 Quarter Pounders with cheese, large fries, a huge shake, and some massive dessert. Relatively, I would say, inexpensive for the sheer calorie and fat load he just absorbed. And so again, one of the geniuses of the American economy is it will create more for less. And it'll create it in the most convenient and sort of addictively delicious way you can imagine. This kid was 10. 10 more years of that, and you have the beginning of obesity and all of the ailments that come with it. How do you incent people to pay more attention? What the French would say, and if you've ever been to Europe, you see this, they don't eat the portions we eat. You look at the portions, these supersized portions. I have a map I have in my office of the United States, go back to 1980. Level of obesity in the population shown in a certain color. And then go to 90, 2000, 2010. It looks like the map caught fire. An explosion of obesity in what is a relatively small period of time due to the nature of American diets, the convenience of fast food, and an acquired lifestyle. And then another attitude that goes with it, which is when you go, this is my barber's story. My barber was saying to me the other day, not so long ago anyway, he's an Italian guy, shall we say, a little rotund. And he said, "You know, it's lucky, Chet, that I was, we got stopped in the traffic jam on the highway, and it was lucky I was able to sustain it." And I said, what do you mean? He said, "Well, I had food supplies with me." I said, "Well, what did you have?" And he described, what had to have been 20,000 calories worth of stuff. And I said, "Well, aren't you concerned that that isn't so healthy?" And he said, "Yeah, but I take my cholesterol pill and I take my blood pressure pill." And so I want to just tell that story to illustrate one other thing. The attitude of the American public is, I don't want to change anything. Fix me. I want to lay on the couch with crumbs all over me. I want to watch the game. And I want to get fat if I want to get fat. Fix me. With that, very hard to correct. So I'm oversimplifying things, but you get my point. There has to be, we think, incentives on the part of everyone involved in the equation, all the stakeholders, as you say, that reinforce each other towards a difference. Remember when you could always smoke in a restaurant, and now you can't, and there was predictions of how bad that would be? Well, it wasn't bad, and it's now an accepted thing in society. That kind of change, I think, has to come about. And there may be evidence that it's occurring, and maybe there's hope in that. The problems are daunting. They are not defeating, and there's a difference.
All right. Unfortunately, guys, that's about all we have time for question-wise. So I'm going to hand this back over to Vice Dean Russell.
Thank you. Well, on behalf of the school, I know for me personally, teaching leadership, I could just play this over and over again about this issue about service and purpose, and is your job a job or a calling? And I think it was just incredibly inspirational in terms of everything that you said. So I know that you've had an impact on all of us here and getting people to rethink some things. And I'm also glad that I don't go to fast food places, too. So, but we do have something here for you from the Smith School. So we'll find it behind all these trees. Thank you. So I think there's several minutes
Okay,
here.
thank you.
So again, we'd just like to say thank you
Thank you
so
so much.
much.
My
We
pleasure.
really appreciate it, and it really was an inspirational talk, so thank you.
Well, thank
We
you.
can give him another round of applause.
Thank you.